Hello everyone, I'm Dr. Vikas Sharma, consultant dermatologist, Derma One Clinic and a hair transplant surgeon. Today I will be describing about hair transplant in a patient with limited donor area. So not everybody is a good candidate for hair transplant. Some people who have very huge bald areas, like who are grade 7 or grade 6 patients who have lost a lot of hair on the top of their head, may actually benefit from some hair transplant procedures, but some of them may not actually be good candidates for hair transplant. They should rather opt for some other methods also, like hair wig and stuff. But having said that, some patients do benefit from hair transplant as well. So in such patients, the important thing is the availability of donor area. Now the donor area can be the back of your head, can be the neck side, this area of the beard, and can be chest hair as well. So all these hair can be combined to give a gratifying result, even in patients with low donor area availability. Now the hair on the back, they are pretty decent when they are transplanted. The hair on the beard also are pretty sturdy when they are transplanted onto the head. The only difference is that the beard hair have a slightly different texture and the thickness is also slightly different, so they need to be intermingled with the existing hair or the hair which have been transplanted from the back of the head. The third donor area is the chest. Now the chest hair are typically slightly thinner and they don't attain that much length also, so they are primarily reserved for increasing the density very slightly. They don't really give very good results. Also the survival is also an issue, like the hair on the chest, they are not very sturdy, so they may not survive. All of them may not survive when they are transplanted onto the top of the scalp. So we need to do it very carefully. Instant implantation may be one method with which you can increase the potential survival of the grafts on the chest also. And these hair typically don't give too much of density, but yes, they're decent for coverage in some people who have very good quality chest hair. So these things are important. In addition to this thing, the angles of the hair are also very important. So flat angles typically tend to give an appearance of more density. More vertical angles may not give very good density. So if the hair are placed flat on the scalp, they tend to cover a larger area. If they're placed vertically, then in that situation they may not cover a good area. Also in such patients, there may be some techniques which can be adopted to give a good coverage. For example, if somebody is combing his or her hair from left to right, in that situation we can transplant more on the left side and lesser on the right side, so as to cover more area with less number of grafts. Also the frontal density is kept higher in such patients, so the front hair, when they are combed backwards, they provide coverage to the back side also. So these are some of the methods with which a good result can be achieved in patients with extensive hair loss and poor donor area availability. If you would like to know more about it, please comment in the comment section below. I'll try to reply to all your queries.